Welcome to Invest Insights. I'm Abby Melone. I'm joined by Daryl Tol, the President and CEO of AdventHealth for the Central Florida Division. He joins us for our discussion on the COVID-19 pandemic. Don't forget to like this video and subscribe to our channel to watch more insights like this. Daryl, we are finally at the moment where we're talking about opening up the state of Florida. Governor DeSantis just had a press conference yesterday where he talked about having a methodical, slow, and data-driven reopening. And on that same panel, Charles Lockwood for University of South Florida College of Medicine had said that he projects that we need 150 tests for every 100,000 people, which would be about 33,000 tests a day. Where are your thoughts on this moment in time of the reopening? Do you think that you have enough tests to support the information that I just gave? What is your take on this moment and getting prepared for the reopening of the state?
Sure. First of all, great to be with you. Thank you very much. The testing question is a good one because that's our eyes and ears. That's how we sense the presence of the virus. We have a fraction of what we need. I've heard 40,000, I've heard 50,000. I think 35,000 is not irrational. Regardless, it's about double what we've had in the state historically, and that number is ramping up. We've worked hard to grow testing for several reasons. One, because we need to see what's present today. But two, we actually are planning to test every one of our staff, every physician, and every patient coming into our facilities as we get into reopen phase, and to do a surveillance on a regular basis of our staff and physicians and test every patient. So you can imagine, aside from the public health goals of seeing whether this is present across our community, health systems and perhaps other businesses will want to know if it's present in their hallways and in their buildings to keep really good controls on it. So testing is a very important part of a reopening strategy. We have about 6 points. Testing's one of them, and it's a really important one.
Well, that sounds like a lot of volume that you'll have to be prepared to test for. And I have been speaking to a lot of hospital systems in the state of Florida. And I think on the positive side, the surge that we were preparing for is not what we have seen. And it seems to be that we are past the surge at this moment in time. That is the positive side of the story. The other side of the story is that it's been with the closing down of elective procedures and the deterrence of normal flow into the hospital being very much slowed, that has really hurt a lot of hospital systems' bottom line. Can you comment on how AdventHealth has experienced the surge, lack of surge, holding off on elective procedures, and how that's affected your financials?
Absolutely. I think it was very prudent for the industry to and the government to predict a surge. We were seeing it in Italy. We were starting to see that in New York. And we took rapid action in advocating for shelter in place, social isolation strategies, which kicked in counties and statewide in Florida. And we think cause and effect bent the curve. It worked. You'll have people say, well, see, we didn't even need that, but that's an error of logic. The shelter in place bent the curve. It also eliminated all business, essentially, that wasn't COVID in many categories of work. Elective procedures, many office visits disappeared. Even really critical visits dropped substantially. Visits you would typically see in areas like heart disease and stroke really dropped, and we're worried about people. We're actually worried that people are staying home when they should be coming into healthcare facilities. When we count all that up at AdventHealth, we know revenue will be down for the impacted period, hundreds of millions of dollars as a national company. And we did not lay off staff. We protected our team throughout. One, they're critical to us. We believe we'll need to get back to work soon. Two, the surge would have required a lot of people, and the last thing we wanted to do prior to a surge is lose some of our great team members. So we don't expect our expenses to be down considerably, even though our revenues will be. So a lot yet to come through the pipe there as far as the actual condition of things. Organizations with a strong balance sheet will weather it far better than those who didn't have the balance sheet required.
Indeed. And we've watched telemedicine play a big role recently, and there There's a lot of preparation for telemedicine and a lot of hospital systems that had to push forward measures so that they could communicate with their normal clientele. What is the future for telemedicine for AdventHealth mean post-COVID? And what does it also mean for electronic health records?
Right. You know, it's been a blessing that we've been working on telemedicine for 3 years. Adoption has been slow on the part of physicians and even on consumers in certain ways. And that barrier just disappeared with COVID. We've seen telemedicine rates of use up 180, 200%, 300%, depending on the category. Consultants rounding in the hospital using telemedicine, the primary care doctors doing their visits that way, people accessing our e-care, which is our virtual app-based visit with a provider. All of those have gone really significantly higher. We think this is a launching point for telemedicine, a pivot point. So federal guidelines that really opened up the landscape to allow telemedicine to happen more easily and licensure issues and reimbursement issues to happen more easily. We hope and will advocate that many of those stay in place. That will really be a game changer for healthcare. Then we're actually accelerating our investment in telemedicine. We're, despite the difficulties, we see it as an important launch point. And so things that we were going to do over 2 years, 3 years, we're planning to do over a period of months, over a period of a year. We're really pushing to keep the momentum in digital health because we think it's a really critical tool for the future and it can save lives too.
And Daryl, should our audience want to find out more information about AdventHealth, where would you direct them?
Well, we have a couple of places they can go. If they're analog, we have 877-VIRUS-HQ. They can give that phone number a call and talk to a live team of folks who are ready to answer all manner of questions about our response and our position. AdventHealth.com is our website, and AdventHealth.com/coronavirus resource hub. Coronavirus-resource-hub is a great place to go to find out specifically about the coronavirus and our response to it.
Wonderful. Well, thank you again. That was Daryl Tol, the President and CEO of AdventHealth for the Central Florida Division. Don't forget to like this video and subscribe to our channel to watch more insights like this. You've been watching Invest Insights, and my name is Abby Melone. Thank you for watching.